Hello, my name is Penny Edwards and I'm a health protection nurse with Public Health England South West Centre. This presentation has been produced by members of the South West Public Health England team and colleagues in NHS England. This is one of a series of 4 videos covering a range of topics relating to the prevention and control of the new coronavirus known as COVID-19 and is intended for staff working in the care home, supported living and home care sectors. This presentation focuses on what is COVID-19, highlights key guidance, discusses social distancing, shielding and self-isolation, and how to recognise a possible case of COVID-19. We know that there is a lot of guidance out there about the new coronavirus, and I hope that this presentation will help to summarise the information most relevant to you. This pandemic is constantly evolving, and this means that the guidance is too. The information in this presentation is correct as of the 8th of April 2020, but it is vital that you keep up to date with the most recent guidance online. Many of the documents referred to can be found by searching COVID-19 on the gov.uk website. Links to these and others are provided in the document attached to the email that you've been sent. I speak to care staff all the time at work, but I don't pretend to know what you're all going through at the moment. For that reason, we would like you to listen to these presentations and let us know what questions you still have. We are also keen to hear your experiences and suggestions and for these to be shared across the sector in the South West. So please do email your questions and comments to the email provided. And also you'll find invitations in the email that you were sent with details of how to dial into upcoming teleconferences where we would like to bring everyone together to discuss the issues that are most relevant to you. These are 2 key websites, and we recommend that you pause now and search for these and save them to your desktop favorites bar if you haven't done so already. So by the end of this presentation, we hope that you'll be able to describe the new coronavirus, the illness and the way it's transmitted from person to person, understand where to find the guidance for care homes, supported living and home care, understand how to prevent the spread and to recognise a potential case of COVID-19. Okay, so coronaviruses are a large family of viruses, some of which can cause infections in humans. Some cause less severe disease like the common cold, and others more severe disease like the MERS and SARS coronaviruses. This virus is new and so it is not recognised by our immune systems, meaning that everyone is potentially susceptible. I'll be using the term COVID-19 for the rest of this presentation, and I'll use the word resident or client or person interchangeably. Also, the word case means someone that is suspected of or is confirmed as having COVID-19. This slide outlines the clinical features of COVID-19. And it's really essential that prompt identification of a person who may have COVID-19. It's really key in stopping the spread to others. So COVID-19 should be suspected when someone has a new continuous cough or a fever. This means having a temperature of 37.8 degrees or above. A new continuous cough means coughing a lot for more than an hour or 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. The cough is usually dry and people can become short of breath. Some people might have a flu-like illness with fever, muscle aches and respiratory symptoms such as wheezing or a hoarse voice. Older, frail people may not develop a temperature, but you may notice that they are just not themselves and may have a sudden increase in confusion or falls. You know your residents well, and if you're concerned that they have any new symptoms which might mean they have COVID-19, you should act on this and take the precautions outlined in this presentation. The incubation period, which is the time from becoming infected to showing symptoms, ranges from 1 to 14 days, but the average is around 5 days. People are thought to be able to affect others from the time that their symptoms start. People are thought to be much less infectious after 7 days, but in older, frail people, their immune response may be different, and so it's recommended that they are considered to be infectious for 14 days after their illness starts. COVID-19 is spread through droplets and with contacts. So when somebody coughs or sneezes, large respiratory droplets are produced. These droplets can reach another person when within 2 meters of each other, and then can enter the eyes, mouth, nose, or airways to cause infection before falling onto surfaces and the floor. So surfaces within 2 meters of that person can become contaminated with these droplets and then can become a source of infection when touched by another person if they are then transferred to their own mouth, nose, or eyes. Surfaces include objects in the immediate environment, tissues, and also the hands of a person with infection. The virus can be spread through the airborne route. This happens, though, just during certain procedures known as aerosol generating procedures. For example, suctioning of tracheostomies, chest physiotherapy, or non-invasive ventilation. These are unusual in community care. However, they will be covered in brief in the staff protection and wellbeing video. The virus has also been found in feces and in tears, and so all body secretions and excretions, except for sweat, should also be considered as potentially infectious. It is thought that the amount of virus on surfaces reduces dramatically after 72 hours and is easily removed by detergents, followed by chlorine-containing disinfectants. The virus is also easily removed from hands by washing with soap, water, and drying, or by using alcohol-based hand gels. So one way to prevent the spread of COVID-19 is through social distancing. And these are the measures that we've all been asked to adhere to. It's about staying at home and only going outside for food, health reasons, or work if you cannot work from home. And if you do go outside, to stay 2 meters away from other people at all times. Wash your hands as soon as you get home and do not meet others, even family or friends. Whilst working in a care setting, social distancing is obviously difficult to achieve. There are some things you can do, like cancelling gatherings and communal activities. And if you are caring for people in their own homes, try to distance from others in that household. Social distancing is particularly important to protect those most vulnerable to infection and to the effects of the infection. And the social care and care home sectors are absolutely vital in keeping some of the most vulnerable people in our society healthy, safe, and out of hospital. So social distancing is particularly important for people who are at high risk of severe disease. And these are people aged 70 or over, regardless of medical condition, or those under 70 with an underlying health condition. These are the people that would be asked to have a flu immunisation every year on medical grounds, and also includes pregnant women. Some residents may be considered extremely vulnerable and need to practice shielding. This means staying in their rooms, including for meals. If you have a look at the gov.uk website and search for shielding, you'll find a full list of the conditions that apply. In order to protect such individuals, even if they do not have symptoms, staff delivering care to them must wear gloves, apron, and a surgical mask. Staff visiting people in their own homes, if anyone in that household is shielding, should also wear these. So I know that it's now common practice for care hands to have stopped visiting to the home, or at least severely restrict visiting to protect the residents and staff. Family and friends should not visit care homes except next of kin in exceptional circumstances such as end of life. In these situations, visitors should be limited to one at a time to preserve social distancing and ensure that they themselves do not have symptoms or be exposed to the virus. For some visitors, the risk to them of visiting is just too great, and this risk needs careful assessment and discussion with them. Alternatives may need to be considered, including use of telephones or video calls. But there are other things that you could do if the visit is essential to reduce the risk of spread. So visitors should be reminded to wash their hands for 20 seconds on entering and leaving the home. They need to wear personal protective equipment and to be shown how to do this safely. More information on PPE is in the staff protection and wellbeing video. Visitors should minimise contact with other residents and staff and should visit the resident in their own room directly upon arrival and then leave immediately after the visit. You might consider symptom screening as people arrive at the home, as people with symptoms must not enter the home. This is obviously a very distressing situation for the relatives and family, friends and the residents themselves and for you. And the British Geriatric Society has recognised that and has published some really useful information and ideas. And this website is included in the list of links that was sent to you in the email. So care homes should implement twice daily monitoring of COVID symptoms amongst resident and care home staff. If you work with people in their own homes, call ahead and ask about symptoms in them or anyone else in that household so that you are ready with the correct personal protective equipment. Assess each resident twice daily for the development of a fever, so a temperature of 37.8 or above, a new cough or shortness of breath. And here's a reminder of the symptoms we discussed earlier. It will mean that a number of people may be suspected of having COVID-19 when they in fact have something else, but it is advised that the precautions discussed in these videos are taken as soon as the possibility of COVID-19 infection is raised. If you suspect COVID-19 in a resident, contact the NHS 111 COVID-19 service for advice on assessment and testing. If further clinical assessment is advised, contact the GP. If symptoms worsen during isolation or are no better after 7 days, contact the GP again for further advice around escalation and to ensure person-centred decision-making is followed. For a medical emergency, dial 999. Continue to use tools such as Restore 2 and TEPS to assess and manage care. If you care for people with a learning disability and/or autism, we suggest that you read this guidance, which has some good information about the additional things you can do for caring for this group of people. Search the england.nhs.uk website. Please ensure that you communicate the person's infection status, or if you suspect an outbreak in the home, to communicate this to any visiting healthcare worker or to the hospital if admission is necessary. If a person dies in the care home, you should continue to communicate with mortuaries in the usual way and inform them when a death is suspected to be due to COVID-19 infection. And if a person dies of this infection, it's just a reminder that the same precautions described in these videos apply after death as in life. And guidance about care of the deceased can be found on the gov.uk website. So this is about what to do if somebody has symptoms compatible with COVID-19. So staff with symptoms must stay at home for 7 days after the start of your symptoms. So you can return to work on day 8 as long as you've had 2 clear days of fever, so 2 days clear of fever. A residual cough may continue for several weeks, but if you're otherwise improved and you don't have a temperature of 37.8 or more, then isolation can stop and you need to be feeling just generally better in yourself. A member of staff who has a family member in their household who has symptoms must self-isolate at home for 14 days from the onset of that illness of the unwell person. Please see the stay at home guidance on the gov.uk website for more information. Staff who have been exposed to COVID-19 whilst at work can continue to work as long as they do not have symptoms. Residents with symptoms need to be isolated for 14 days from the onset of symptoms. And also the residents who have been assessed as being close contacts should also isolate for 14 days from the day of exposure to the infectious case and be closely monitored for symptoms. The reason for the difference between care staff and care home residents is because residents are a particularly vulnerable group and their immune system response may differ from other people. So additional infection control precautions will be required, and these will be covered in the other videos. So these are some of the links that you've been signposted to, and they're contained in the email that has been sent. So finally, just to say thank you to colleagues from South West and London Health Protection teams and in NHS England, NHS Improvement. And just a reminder really to please do send your feedback, questions and suggestions to the email address provided, and please do join the question and answer sessions, and the invitations again are in that email. Thank you very much.